This is BoomerLife on CL650.
Lying in bed, just like Brian Wilson did. When I'm lying in bed, just like Brian Wilson did.
And welcome back to the show. You're listening to BoomerLife on CL650. I'm Zach Spencer, and we're talking about getting a good night's sleep. We are doing a greatest hits today of previous shows, and we had a fantastic guest on a couple of months ago, Dr. John Fleetham. He's the founder and co-director of the UBC Hospital Sleep Disorder Program. So let's go back and listen to a sample of that conversation right here on CL650. You're speaking to us today from Vancouver General Hospital. So can you give us a little bit about your background and how you got into this avenue of medicine?
Well, I trained in the UK. I came to Canada in my early 20s, and as one does, I met a cute emergency nurse and decided to stay for a little bit longer. I finished my training in Kingston, Ontario, then I went to Winnipeg, Manitoba, and then started to get interested in sleep there, did some research in sleep. I was recruited to UBC when it was expanding its medical school in the early 1980s. And then we set up the first clinical sleep laboratory in Western Canada in the early 80s.
And you've been doing it ever since?
I've been doing it ever since. I mean, when I arrived, there was a condition which is interesting called sleep apnea. If you look at the history, sort of Shakespeare described it, Dickens described it, even the giant in Jack and the Beanstalk clearly had sleep apnea, but doctors, because we like diseases that occur Monday to Friday, 9 to 5, hadn't really sort of thought much about sleep. And at that time, there was just starting to be some interest. I think actually, fortunately, nobody had sleep apnea when I first came to BC, and it now almost seems that everybody has sleep apnea. So it's been an evolution in terms of understanding how common it is, understanding its importance, understanding how to diagnose it, and then in the early days we had no treatment, and now we got a whole variety of treatments. Well,
I know several people that have these what they're called CPAP machines. Is that what they're called?
That's correct, yes.
And as you mentioned, 20 plus years ago, nobody had this problem. Now I know so many people that sleep with them as a way to help with sleep apnea. So is that the number one go-to sort of device for helping people?
Yes, I mean, we'll probably talk about that a little later on. I mean, How we used to do this in the early days was do a tracheostomy. And that was very invasive. And then CPAP was introduced. Actually, it was introduced in the early 1980s. And essentially what it is, it's a reverse vacuum cleaner that blows air into your nose. And everybody thought the inventor of this was absolutely crazy. But, of all the things I've done in medicine, people come to me on a daily basis and say, I feel 1,000% better. Well, that's a game changer. And it's the same thing as when you have glasses. When you don't have glasses and suddenly you get glasses, you suddenly realize what you haven't been able to see. And quite often when you treat sleep apnea, people are amazed how well they feel when they wake up in the morning. They've never woken up feeling refreshed in the morning.
All right, let's go back to the actual basics of sleep. What's happening when we sleep, and how much sleep do people typically need to get?
Well, I mean, it's important to care about sleep. It's interesting. The 3 secrets to a long and healthy life are good diet, good exercise, and a good sleep. And actually, we, in terms of public attention, we very much focus on the first 2, and we don't focus on having a good sleep. And there are a variety of things which we do. So electric lighting, TV, the internet, and now caffeine, all of these interfere with our sleep. Sleep is a period of renewal. It's a period of renewal both physically and mentally. And if you sleep poorly, then you have poor health. And if you have poor sleep or a sleep disorder, it impacts your quality of life, but also causes a decreased life expectancy.
I remember reading stories about the Vancouver Canucks had taken on a sleep expert to help with the players traveling on the road, getting them in a regular routine. Did you have any part of that, or do you know?
I wasn't part of that, but no. I mean, the centers of excellence in terms of sleep are both Vancouver and Boston. And the reason we lost the Stanley Cup, it was widely rumored, was that they had better sleep experts than we had and everything like that. But, it's the whole issue of sleep and athletes is a very important field, and it's a bit of a digression from what we're talking about, but a lot of athletes to perform well have to sleep well, and certain athletes, certain swimmers, they have to get up early in terms of training. So sleep, you can be sure that our Olympic team has sleep experts on it.
Well, I hope it works. We like those gold medals for sure. So what happens when you're not getting enough sleep to your body? So you go to bed at night, and that's when your body is repairing itself, and your brain is, it's cataloging the day's activities and all those things that happen. So what happens when you don't get enough sleep?
Well, it's the usual things that people who work shift works. I work at a hospital, so I get called all through the night and everything like that, or when we've had young kids, it's the usual things of, the next morning. So, you can't concentrate as well, you're not as smart as you were, you're usually more irritable, and I think everybody's familiar with that, but it's more than that. It's been shown that if you don't sleep well, you're more likely to get infections. Interestingly, if you don't have a good night's sleep prior to your flu vaccination, it's likely to be less effective. There's a clear link in terms of poor sleep and gaining weight. It predisposes to diabetes, and you're much more likely, if you don't sleep well, you're more likely to have accidents at work. And an area of interest I know for you, Zach, is you're much more likely to have car accidents because, you're drowsy at the wheel.
Mm-hmm. I can tell you another personal story. I used to do the morning news on BCTV on Global. I used to have to get up every day at 4:30 in the morning. And I am just not wired to get up at 4:30 in the morning. I know my regular cadence of when I should go to bed and when I should get up in the morning, and 4:30 isn't it. And I did that for almost 10 years. And I got to say, for the last 5, I think I was sick pretty much the whole time. I had a cold, developed asthma, had so many health issues. And I stopped doing that show, and now I sleep a more normal pattern. And a lot of those issues have gone away. Do you think there was some correlation there?
Absolutely. Shift work. Many people work shift work, and there's no doubt it has an impact on their health. There's a clear link in terms of life expectancy and the number of hours which you sleep. So ideally, adults should sleep 7 or 8 hours. If you sleep less than that or more than that, your life expectancy is going to be shorter.
I think I sleep more than that. I think.
Well, the two sorts of sleep problems: too little and too much.
I didn't think you could get too much sleep. I love sleeping. Some people think it's wasted time. I think it's the best time of the day going to bed. Is it good to look forward to getting a good night's sleep?
No, I think that's excellent. But you should wake up after 8 or 9 hours and feel refreshed and ready to go.
Oh, I thought you said 7 or 8. Yeah, I'm doing 8 to 9.
I did say 7 and 8, but I thought I'd be generous for you.
Okay, that's good. I'm in the window now, so I'm good. So now we have Farouk here from SleepShop, and you obviously study people and how they sleep. What you sleep on, does that greatly affect the quality of sleep you're going to get?
Well, if you don't sleep well, then it's very important to work on something called sleep hygiene. And these are all the motherhood things which our mother sort of was supposed to have told us in terms of, going to bed at a regular time, getting up at a regular time, having a dark room, having a quiet room, but also clearly having a comfy bed. There's this well-known effect if you spend the first night in a different place, such as a hotel, you tend not to sleep as well as that. And your bedroom needs to be a special place, and it needs to be quiet, dark, and comfortable.
Mm-hmm. And I guess we touched on sleep apnea. Can the bed help with that?
Sleep apnea is more common if you lie on your back. So sleep apnea happens when when we fall asleep, we relax all our muscles, and the biggest muscle we have in our mouth is the tongue. There are a whole bunch of muscles there, and they relax during the night when you're asleep, and so everything falls backwards and causes narrowing, and that causes snoring, and then sometimes the tongue falls all the way back and cuts off the breathing. So if you're sleeping on your back, you're more likely to have sleep apnea. But sleeping on your side, and there are special pillows that you can get in terms of sleeping on your side, will help that. But But sleep apnea is a common thing, and it's caused by issues that run in families and also being overweight. So a comfortable mattress can help, but it's not the basic treatment for us.
So what other sleep disorders? We touched on apnea. What are the other common disorders that people suffer?
Well, there are huge textbooks on sleep apnea, and there are about 50, 80 different sleep disorders. I mean, the common ones everybody knows about are insomnia, and we've all had that at some time, and so there's difficulty falling asleep, there's difficulty staying asleep, and then as you get older, or if you're depressed, there's early morning awakening. There's sleep apnea, and perhaps we'll talk about that more. There's a condition called narcolepsy, which is actually quite common. Affects 1 in 2,000 people. These people are very sleepy, and then they have periods of sudden loss of muscle tone stimulated by intense emotions. And it tends to present in young people. And then there's conditions called parasomnia. These are strange things that happen to people while they sleep. So sleep talking, sleepwalking, night terrors, all of these. And
these are real things. They're not just. It's not just urban folklore that people do.
No. These are very common. And you remember there was a star, I think Chris Hyman.
Yes, in Toronto.
CBC.
Yeah, I was going to bring that up. They had the television show on CBC, and he walked off his balcony or something?
Well, that was what his mother was reported to say. I'm not sure. I don't know any inside information, but
he was known to be a sleepwalker.
Sleepwalking and sleepwalking. One of the things, if you have sleepwalkers, is to make sure that they are secure because they're not aware of it. There's another condition called REM behavior disorder, where people will hit out at their partner during sleep. And it's been known now that precedes the onset of dementia or Parkinson's disease. So it's a sign of early development of that. And if it's picked up on, then you can introduce treatment sooner rather than later. Many different sleep disorders.
Before we take a break, I have the one where you're sort of half asleep and your leg kicks quickly, or what's happening there?
That's totally normal.
That's
totally normal, and that's so you have tone in your muscles, and when you fall asleep, you lose that tone, and so that's what that reaction is. So there is. I don't know whether you remember Seinfeld, but Seinfeld, there was somebody, I think it was Kramer, described the Jimmy legs.
Yeah.
And so there's restless leg syndrome or periodic limb movement, and those people kick every 20 seconds during the night.
Ooh.
And that's very irritating to their bed partner, but also sometimes when they kick, they will also wake up. And so, but that's very different from what I think you're describing, which is totally normal.
Yeah, just as you're about to really go into sleep, your leg twitches and you wake yourself up again.
Yeah.
Or your arm twitches,
That's normal.
I thought, I have the expert, I have to ask. That's an excerpt of an interview we did with Dr. John Fleetham. He's the founder and co-director of the UBC Hospital Sleep Disorder Program, part of Vancouver General Hospital. We're not done with the doctors, though, here on SleepShop with our guest, Farooq Manji. We're going to touch base with him again towards the end of the show. We have next Dr. Rosina Budwani, a chiropractor, and how that affects your sleep. Next, right here on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.